territory, including East Jerusalem, and following 2 recorded votes, adopted a draft resolution. Concerning matters under Promote Health, the Board noted the relevant reports and recommended the Health Assembly adopts a decision to defer consideration of the draft Global Plan of Action for the Health of Indigenous Peoples to the 80th World Health Assembly in order to allow additional time for further consultations. The draft strategy on economics of health for all and a resolution on radiation and health, strengthening global protection, preparedness and response. With respect to matters under Power and Performance, the Board welcomed the report of the Program Budget and Administration Committee and noted the various reports, including on the financing and implementation of the Program Budget 2024-2025 and outlook on the Program Budget 2026 to 2027. The Board approved the organisation-wide evaluation work plan for 2026 to 2027 and adopted a decision on non-state actors in official relations. The Board also adopted a decision to streamline the Foundation Committees and selection panels. The Board recommended that the Health Assembly adopts the proposed amendments to the process for the selection of the external auditor and a resolution presented by a Board member on acknowledging the notification of withdrawal of the Argentine Republic from the World Health Organization. Regarding the reform of the global health architecture and the UN 80 initiative, the Board adopted an amended decision in which it requested the Director-General to design a proposal on a joint process hosted by WHO, which is led by Member States for consideration by the Health Assembly. Finally, regarding Member State-led governance reform, the Board took concrete steps to move from commitment to implementation. We adopted a decision on piloting agreed reform measures led by the officers of the Executive Board, as well as a decision on a sustainable model for Member State-led governance reform. This work reflects a shared commitment by Member States to sustain WHO as a trusted, effective and efficient global health institution. These proposed reforms are essential to enabling meaningful Member State engagement by all Member States and improving how we govern ourselves, make better choices and live within our means. A stronger, more transparent and effective WHO is essential to ease pressure on the global health system. Mr. President, distinguished colleagues, let me conclude by conveying my highest regards to you all and indicate my readiness to respond to any questions or clarifications you may need. Thank you.
Muchas gracias, señor Comley, por el excelente informe. Aprovecho esta oportunidad para rendir homenaje a la labor del Consejo Ejecutivo y, en particular, para expresar nuestro reconocimiento y nuestro más sincero agradecimiento a los miembros salientes que han contribuido muy activamente a la labor del Consejo. Con esto concluye nuestro examen del punto 2 de la orden del día. Y ahora vamos a pasar al punto 3 de la orden del día, que es la locución del doctor Tedros Ghebreyesus, director general. Invito al doctor director general a subir a la tribuna. Doctor Tedros, tiene la palabra.
Maybe we have to raise this a bit. Anyone who can help? Blake? Just a bit. Okay. You moved it. So this way. No. President of the 79th World Health Assembly, Dr. Victor Atala Lajam, Excellencies, Honorable Ministers and Heads of Delegation, dear colleagues and friends. Early on Sunday, I declared a public health emergency of international concern over an epidemic of Ebola disease in the Democratic Republic of the Congo and Uganda. This is the first time a Director General has declared a FIC before convening an emergency committee. I did not do this lightly. I did it in accordance with Article 12 of the International Health Regulations after consulting the Ministers of Health of both countries and because I'm deeply concerned about the scale and speed of the epidemic. We will convene the emergency committee today to advise us on temporary recommendations. So far, 30 cases have been confirmed in the DRC from the northern province of Ituri. Uganda has also informed WHO of 2 confirmed cases in the capital of Kampala, including 1 death among 2 individuals who traveled from DRC. And there is 1 US citizen confirmed positive and transferred to Germany, as reported by the US. And we're working with the DRC, Uganda, and also the United States. First, beyond the confirmed cases, there are more than 500 suspected cases and 130 suspected deaths. These numbers will change as field operations are scaling up, including strengthening surveillance, contact tracing, and laboratory testing. Second, cases have been reported in urban areas, including Kampala and the city of Goma in the DRC. Third, deaths have been reported among health workers, indicating healthcare-associated transmission. Fourth, there is significant population movement in the area. The province of Ituri is highly insecure, as you may know. Conflict has intensified since late 2025, and the fighting has escalated significantly over the past 2 months, resulting in civilian deaths. Over 100,000 people have been newly displaced. And in Ebola outbreaks, you know what displacement means. The area is also a mining zone with high levels of population movement that increase the risk of further spread. And fifth, this epidemic is caused by Bundibujo virus, a species of Ebola virus for which there are no vaccines or therapeutics. In the absence of a vaccine, there are many other measures countries, of course, can take to stop the spread of this virus and save lives, even without medical countermeasures, including risk communication and community engagement. I thank the government of Uganda for postponing the annual Martyrs' Day celebrations, which can attract up to 2 million people because of the risk posed by the epidemic. WHO has a team on the ground supporting national authorities to respond. We have deployed people, supplies, equipment, and funds. I have approved an additional $3.4 million from the Contingency Fund for Emergencies bringing the total to $3.9 million US. And I would like to use this opportunity to thank all countries who contribute to the CFE, and we will continue to keep all member states informed. As you know, WHO is also responding to the outbreak of hantavirus among passengers and crew on the MV Hondius cruise ship. The passengers have all been repatriated and will be monitored until the quarantine periods end on the 21st of June. Yesterday, the Hondius arrived in Rotterdam, where the crew disembarked and will be quarantined until the 29th of June. For the past 2 weeks, I have been in regular contact with the captain of the ship, Captain Jan Dobrowski of Poland, and I would like to thank him for everything he has done for the passengers and crew under his care. I'm sure Poland is proud of Jan. WHO's assessment continues to be that the risk of hantavirus globally is low. So far, there are 11 reported cases, including 3 deaths, and no deaths have been reported since the 2nd of May, when WHO was first informed of the outbreak of the ship. Those numbers have changed little since the outbreak was first reported to WHO 2 weeks ago. As things stand, there is no sign that we're seeing the start of a larger outbreak. But of course, that could change, and we urge all affected countries to continue monitoring the passengers and crew carefully. I thank the many countries involved in the response. Spain not only met its legal duty under the international health regulations, but also its moral duty to the passengers and crew. I would especially like to thank Prime Minister Pedro Sanchez for his leadership and for his inspiring message at this assembly yesterday. Spain handled the situation with compassion and kindness to the passengers and the crew, and not just the legal obligation. I also thank South Africa, which was the first to confirm hantavirus at the National Institute for Communicable Diseases in Johannesburg, after the first patient was evacuated there. And I thank the UK for notifying WHO and all countries through the IHR. And I thank Cabo Verde for helping with the evacuation of the 3 symptomatic patients. I thank the Netherlands, which has been actively involved through every stage of the outbreak and has received the evacuees from the ship. And I thank Argentina and Chile for sharing their expertise and support in the epidemiological investigations and for donating reference material for PCR and serologic testing to 5 reference labs involved in the response. The outbreaks of Ebola and hantavirus in the past 2 weeks show why international threats need an international response. They show why the world needs the international health regulations and why it needs WHO. Despite the challenges we faced last year, of course, there were many achievements to celebrate. The WHO results report contains a comprehensive and interactive account of those achievements, with scorecards and country stories that demonstrate our impact on the ground. I urge you to use it. In one speech, I cannot do justice to the length and breadth and depth of WHO's work or my colleagues' work. But allow me to highlight a few key achievements according to each of the 3 key priorities of the 14th General Program of Work to promote, provide, and protect health. Let me begin with our work to promote health and prevent disease by addressing its root causes. This year, as you know, marks the 40th anniversary of the Ottawa Charter, a landmark declaration that reminds us that health is created in the places where people live, learn, work, and play. I would like to pay tribute to the architect of the Ottawa Charter, Professor Ilona Kickbush, and the then Director General, the late Dr. Hafden Mahler. In the past year, WHO has worked to promote health and prevent disease in 6 key areas. First, tobacco. Last year, the WHO Framework Convention on Tobacco Control celebrated its 20th anniversary. Since the FCTC entered into force, tobacco use has dropped by 1/3 globally and continues to decline in 140 countries. With support from WHO, Maldives became the first country to adopt a generational tobacco ban for people born from 2007. And this year, the United Kingdom followed suit, banning the sale of tobacco to anyone born from 2009 onwards. Just last week, Zambia's parliament approved a landmark comprehensive tobacco control bill after years of work and strong support from WHO. Despite progress against traditional tobacco products, we face a rapidly changing market of new and emerging nicotine products, including e-cigarettes and nicotine pouches. Last week, WHO published a new global report exposing the marketing tactics and strategies driving the global growth of nicotine pouches. Second, health taxes. Last year, WHO launched the 3x35 initiative, calling on all countries to raise the real prices of tobacco, alcohol, and sugary drinks by at least 50% by 2035. In the past 12 months, India, Jamaica, Malaysia, Mauritius, Mexico, Montenegro, Vietnam, Saudi Arabia, Sierra Leone, and Zambia were among countries that either announced, introduced, or increased taxes on one or more of these products. Third, nutrition. At this assembly last year, Member States approved the extension of the 6 WHO Global Nutrition Targets to 2030. 2 of the targets were almost met on exclusive breastfeeding and childhood overweight, so Member States increased them. Almost 50% of children worldwide are now breastfed at least for 6 months. And 146 Member States now have legal measures in place to protect breastfeeding, covering 91% of all births globally. Although obesity continues to rise in many low- and middle-income countries, recent analysis show that obesity rates are plateauing in some high-income countries. Also last year, WHO verified Portugal and the United Arab Emirates for the elimination of trans fat, a leading driver of cardiovascular disease. We would recognize both countries for their achievements later today. Fourth, climate and environment. In the past 12 months, the WHO Alliance for Transformative Action on Climate and Health grew to more than 100 countries, supporting them to build climate-resilient, low-carbon health systems. Member States also endorsed an updated global roadmap on air pollution and health, including a commitment to halve health impacts by 2040. And new data from WHO, UNICEF, Joint Monitoring Program showed that 1 billion more people now have access to safely managed drinking water than a decade ago, saving millions of lives. Fifth, violence, injuries, and drowning. In the past year, 68 countries have reported progress on violence against children, based on the pledges they made at the first Global Ministerial Conference in Colombia in 2024. For example, Benin is rolling out a national plan of action on child marriage while Mongolia is introducing a nationwide child protection workforce. With partners, we launched the first global strategy for drowning prevention with a target to reduce drowning deaths by 35% by 2030. WHO also supported 15 more countries to strengthen legislation and action on road safety. For example, Ghana adopted new safety standards for child restraints in vehicles and motorcycle helmets. We urge countries to agree a strong political declaration at the UN high-level meeting on road safety to be held in July. And 6 cities. Over the past 12 months, almost 140 cities joined the regional healthy cities networks in 24 different countries, including 69 cities in Saudi Arabia alone. And WHO's Urban Health Capacities Assessment and Response Resource Kit was implemented in 14 cities, collectively home to approximately 33 million inhabitants. Participating cities have improved food safety, housing affordability and quality, and indoor air quality. Now to our work supporting countries to provide health by strengthening health systems and primary health care on the road to universal health coverage. Here are 4 areas we're doing that. First, health financing. Following deep cuts to official development assistance last year, WHO developed guidance on responding to the health financing emergency, supporting countries including Cambodia, Ethiopia, Mozambique, and Uganda. We're also supporting Sierra Leone under the leadership of the Vice President to navigate the impact of the cuts while also launching an ambitious health system reform. And with the World Bank and the government of Japan, we established the UHC Knowledge Hub in Tokyo, which is now supporting the first 8 countries with capacity building, knowledge sharing, and by bringing ministries of health and finance together, especially to increase fiscal space. Second, health workforce. The world is facing a shortage of 11 million health workers by 2030, with the biggest gaps in the African and Eastern Mediterranean regions. More than half the gap is the shortage of nurses, as last year's landmark State of the World's Nursing Report showed. In the past 12 months, WHO supported 11 countries facing the most acute shortage to strengthen their national workforce strategies, contributing to commitments for nearly 100,000 new health worker jobs. With WHO support, 38 countries have more than doubled their health workforce over the past 10 years. This Assembly will consider the important additions to the WHO Global Code of Practice on international recruitment of health personnel. Building the capacity of the global health workforce was one of the main reasons for establishing the WHO Academy in Lyon, with the support of the government of France. Following the restructuring, the Academy brings together WHO's work on health workforce strengthening alongside its learning function. The Academy now offers more than 400 courses free of charge in 23 languages, with more than 120,000 enrollments so far. I urge all member states to make use of this resource, and it's because it's there for you. One of the courses offered by the Academy is the Basic Emergency Care Program, which has now been implemented in over 100 countries. 4 African countries are now bringing it to scale in 846 health centers and hospitals over the next 2 years, saving tens of thousands of lives. Third, health products. In the past 12 months, WHO pre-qualified 50 medicines, 6 vaccines, 15 in vitro diagnostics, 41 medical devices, 6 vector control products, and performed 198 inspections of manufacturing sites. We also updated the essential medicines list to include new medicines for cancer and GLP-1s for diabetes in people with obesity. To expedite pre-qualification and procurement, we designated regulatory agencies in 5 more countries as WHO-listed authorities: Australia, Canada, Indonesia, Japan, and the United Kingdom. In addition, we recognized Ethiopia and Kazakhstan for reaching maturity level 3 for regulatory oversight of medicines and vaccines, and Singapore for reaching maturity level 4 for medical devices. And just 3 weeks ago, we designated regional training centers for biomanufacturing in countries in each region: in Brazil, China, Egypt, India, Ireland, Senegal, and South Africa. This is a major step forward in strengthening the global workforce needed to support local manufacturing based on the COVID lessons, as you remember. On AMR, the Global Antimicrobial Resistance and Use Surveillance System, GLASS, showed that 1 in 6 bacterial infections globally are now resistant to antibiotics, and the trend is increasing. To enhance the pipeline of new antibiotics, in March we published 3 new target product profiles for treating some of the most severe drug-resistant infections in at-risk populations worldwide. We also launched the Traditional Medicine Global Library with almost 2 million scientific records. 4th, health data systems and digital technologies. Of the estimated 61 million deaths that occurred globally in 2023, fewer than 1 in 5 were reported to WHO with sufficient cause of death information for reliable public health analysis. Strengthening health data systems is vital to enable countries to generate and use their own data to guide public health action. In the past 12 months, WHO expanded the global digital health certification network to 82 countries, enabling 2 billion people to access their health records on national digital health wallets. And I would like to thank EU for the great support to this new department we have in digital health. And we have now rolled out ICD-11 to 132 member states, and every day our ICD systems receive around 4 million requests for information, enabling analysis of national and global health trends. All of this work is supporting countries to strengthen foundations of their health systems and to help them progress towards universal health coverage. At the same time, we're supporting countries to address specific health threats in 5 areas. First, maternal and child mortality. Last year, WHO released updated estimates that more than 55 high-burden countries are using to prioritize and refocus. With partners, we issued the first consolidated guideline on postpartum hemorrhage, creating a single global clinical standard for the leading cause of maternal death that's saving lives when applied consistently. We also issued our first global guideline on infertility and published updated global estimates on violence against women, which unfortunately show little progress in 20 years. We supported policy change in 50 countries to reduce unintended pregnancy, expand STI and HIV self-testing, and accelerate screening coverage for cervical cancer. This year, with partners, we published new global estimates on newborn, child, and adolescent mortality, showing that in 2024, 4.9 million children died before their 5th birthday. Of course, there is a significant progress compared to 30 years ago when it was more than 11 million deaths a year, but still 4.9 million is big, and we have to continue to strengthen our efforts. Although under 5 deaths have fallen by more than half since 2000, progress has slowed dramatically. Reinvigorating it must be a global health priority. Second, vaccine-preventable disease. In March, we concluded the Big Catch-up Initiative, an historic effort with Gavi and UNICEF to reach children who missed out on one or all routine vaccines, partly due to the disruptions caused by the COVID-19 pandemic. Over the past 3 years, together we delivered more than 100 million vaccine doses to an estimated 18.3 million children in 36 countries. We also supported 7 new countries to introduce malaria vaccines, bringing the total to 25 and targeting 10 million children every year. And we supported 15 more countries to introduce HPV vaccination to prevent cervical cancer. Since we launched the global call to action to eliminate cervical cancer in 2018, almost 75 countries have introduced HPV vaccination, meaning 65% of girls globally now live in a country with routine HPV vaccination. But of course, we need to do more. Despite funding cuts, the Global Measles and Rubella Lab Network processed more than 700,000 tests to detect and respond to measles outbreaks globally. And we conducted an analysis of 31 studies in multiple countries over 15 years that showed once again that vaccines, including those containing thiomersal and aluminum adjuvants, do not cause autism. Third, sorry, it's a long speech. Third, disease elimination. In the past 12 months, WHO has confirmed the elimination of 7 different diseases in 17 countries. And I'm proud to list all of them. Algeria, Australia, Burundi, Egypt, Fiji, Libya, Senegal, and Tunisia have all eliminated trachoma. Kenya eliminated sleeping sickness, and Chile eliminated leprosy. In addition, Bahamas, Brazil, Denmark, Maldives, and Turks and Caicos all eliminated mother-to-child transmission of HIV. And Botswana reached gold tier status on the path to elimination. Some of these countries also eliminated mother-to-child transmission of hepatitis B or syphilis, or in the case of Maldives, all 3, the first country to achieve triple elimination. So congratulations to Maldives. In addition, 5 countries have been validated for maintaining elimination status: Cuba, Oman, Anguilla, Montserrat, and Sri Lanka. And WHO certified Suriname and Timor-Leste as malaria-free. So congratulations to all 15 countries. The special program for research and training in tropical diseases, TDR, contributed to Suriname's achievement through research that helped to reach hard-to-reach populations. We will recognize all these countries today. And I also like to recognize the leadership of Mr. Yohei Sasakawa, who is celebrating 25 years as a WHO Goodwill Ambassador for leprosy elimination, our longest-serving Goodwill Ambassador, and still running strong. Arigato gozaimasu, Mr. Sasakawa. Thank you. Fourth, communicable diseases. On HIV, we took an important step forward by pre-qualifying lenacapavir in tandem with guidelines on its use, supporting the first 14 countries to roll it out. Lenacapavir is one of the most powerful and promising tools in the history of HIV. A long-acting injectable given every 6 months, it's next best thing to an HIV vaccine. On tuberculosis, WHO supported countries to expand access to rapid TB diagnostics, including new tests that can be used near the point of care. We also accelerated the rollout of shorter, safer, and more effective treatment regimens. And the TB Vaccine Accelerator is working with countries to prepare for the rapid integration of new TB vaccines into health systems should they succeed in phase 3 trials. On malaria, WHO pre-qualified the first treatment developed specifically for newborns and infants, as well as 3 new rapid diagnostic tests that can detect strains of malaria that other tests miss. On hepatitis, the Global Hepatitis Report published just last month shows that since 2015, the annual number of new hepatitis B infections has dropped by 32%, and hepatitis C related deaths have fallen by 12% globally. On sexually transmitted infections, WHO issued a first recommendation for the use of doxycycline post-exposure prophylaxis to help prevent infections among key populations. And fifth, non-communicable diseases and mental health. The UN General Assembly adopted the most ambitious political declaration yet, with concrete targets on tobacco, hypertension, and mental health. WHO also issued new guidelines on the use of GLP-1s for the treatment of obesity in adults. And WHO initiatives on cervical, breast, and childhood cancer are now benefiting over 1 million people in more than 100 countries. In partnership with St. Jude Children's Research Hospital, we delivered 1.5 million cancer medicines supporting treatment for 2,400 children in 5 countries. And I would like to use this opportunity to thank St. Jude for their cooperation and leadership in this area. We also supported 14 more countries to strengthen mental health services for children and young people. Since it launched in 2020, WHO's Special Initiative for Mental Health has expanded mental health services to over 90 million people and enabled first-time treatment for more than 1.5 million children and adults. WHO is supporting 13 countries in the Africa region to improve access to neurological medicines for epilepsy and Parkinson's disease, where the treatment gap is more than 75%. Now to WHO's work to support member states to prevent, prepare for, and respond to health emergencies. Most notably, last year, member states adopted the WHO Pandemic Agreement and the amended international health regulations entered into force. Although member states have not yet reached consensus on the pathogen access and benefit sharing system, the PABS Annex, they have committed to continue negotiations, and I have every confidence that you will finalize it. WHO took many other steps last year to strengthen health emergency preparedness and response in 2 key areas. First, prevention and preparedness. Through the Pandemic Fund, with the World Bank, WHO supported 70 countries to develop and implement 41 projects to strengthen surveillance, laboratory networks, workforce capacity, and multi-sectoral coordination. 21 countries completed joint external evaluations. 195 state parties submitted their annual IHR reports, and 25 countries completed their National Action Plan for Health Security. The Global Health Emergency Corps ran its second simulation exercise, Exercise Polaris 2, involving 600 health emergency experts and 25 partner organizations from 26 countries and territories. And just this weekend, we just launched our Global Health Emergency Strategy with a target to have 10% of the world's health workforce ready to respond to emergencies by 2030. The Research and Development Blueprint for Epidemics brought together global expertise to prioritize research and close preparedness gaps for high-risk pathogens, including avian influenza, Rift Valley fever, Oropochu disease, and Ebola. The WHO Hub for Pandemic and Epidemic Intelligence launched an update of the Epidemic Intelligence from Open Source System, or EIOS, which harnesses the power of AI to support more than 120 countries who use the platform every day to quickly identify new threats. Through the International Pathogen Surveillance Network, over 309 partners across 101 countries are also strengthening genomic surveillance to better track pathogens, detect new variants, and guide faster responses to emerging threats. In the past year, the Global Influenza Surveillance and Response System, GISRIS, a network of 165 institutions in 136 countries, tested more than 11 million clinical specimens and shared 65,000 virus samples with WHO collaborating centers. Through the Pandemic Influenza Preparedness Framework, PIP, WHO signed 8 new agreements, giving us access to more than 940 million vaccine doses in the event of an influenza pandemic, as well as antivirals, syringes, and diagnostics. The WHO BioHub coordinated 17 sample shipments to laboratories in 10 countries to guide research and development of countermeasures. We were also on the ground supporting countries to prevent outbreaks of high-threat diseases. We supported preventive vaccination for Ebola for approximately 170 frontline workers in the Central African Republic, DRC, Guinea-Bissau, Uganda, and Sierra Leone. We also established a new stockpile for a monoclonal antibody against Ebola, with hundreds of treatment courses ready to be shipped in 24 hours if an outbreak is confirmed. After a 3-year break, we re-established the preventative cholera vaccination, allocating 50 million doses to Bangladesh, DRC, and Mozambique, thanks in part to a doubling of supply. And to protect against outbreaks of yellow fever, we supported the vaccination of more than 38 million people in the DRC, Guinea-Bissau, Niger, and Uganda. Second, response. In addition to the outbreaks of Ebola and hantavirus that we're responding to now, in the past 12 months, WHO detected 4.2 million signals and supported countries to respond to 50 emergencies in 82 countries, preventing disease spread and saving lives. We released almost $30 million from the WHO Contingency Fund for emergencies to support the rapid response to emergencies in 40 countries. And through the Global Outbreak Alert and Response Network, GORN, we coordinated 58 deployments to support emergency response in 60 countries. As you know, conflict is on the rise in our world, and that's why you see an increase in deployments this year. Last year, we supported the DRC to respond to an outbreak of Ebola, which it controlled within 6 weeks, deploying more than 100 experts, 150 tons of supplies, and vaccinating 47,000 people. In 2025, we also supported Tanzania and Ethiopia to control outbreaks of Marburg virus disease. And in September, I declared an end to Mpox as a public health emergency of international concern. We also continued to respond to the global resurgence of cholera, deploying more than 50 million doses of oral cholera vaccine from the global stockpile. And we launched the first WHO guidelines for the diagnosis and treatment of meningitis and supported the response to meningitis outbreaks with 4 million doses of vaccine. We also continue to work with partners towards our long-held dream of eradicating polio. Last year, 52 cases of wild polio were reported from just 24 districts in Pakistan and Afghanistan, a 50% decline from 2004. So far, this year, 6 cases have been reported. In addition, countries around Lake Chad mounted a joint vaccination campaign that reached more than 83 million children. And with partners, WHO vaccinated over 600,000 children in Gaza, controlling the Strip's first recorded polio outbreak in 25 years. In addition to outbreak response, we also responded to the health needs of millions of people affected by humanitarian emergencies. That included dispatching $150 million of supplies to 97 countries and territories. In Gaza, together with our partners, we organized the transport and shipment of 515 trucks of life-saving emergency health supplies, coordinated more than 82 health clusters, partners, and supported over 2,700 medical evacuations. In Sudan, since the start of the conflict in 2023, we have delivered more than 3,000 metric tons of medical supplies, responded to outbreaks of cholera, dengue, and malaria, and we're providing direct support to hundreds of health facilities. And in Ukraine, we provided almost 20,000 health consultations, supported the medical evacuation of more than 1,200 patients, and provided training to more than 3,000 health workers. In all these places, we continued to see attacks on healthcare as the alarming and illegal new normal of conflict. In 2025, WHO verified 1,385 attacks on healthcare in 19 countries and territories, causing 1,984 deaths and 1,187 injuries among health workers and patients. Of course, WHO does not work alone. As the health cluster lead of the UN Interagency Standing Committee, we coordinate over 1,500 partners. We also coordinated the deployment of more than 100 international emergency medical teams who, together with their national counterparts, provided over 1.8 million medical consultations in more than 17 countries. Excellencies, honorable ministers, Mr. President, this summarizes WHO's work to promote, provide, and protect health. Of course, it's a glimpse. As you can see, it's a lot. I have barely scratched the surface. Supporting all of this work are the Secretariat's efforts on the fourth P of GPW14, to power for health through science, data, and digital technology. As WHO moves forward following last year's prioritization and realignment, one of our priorities is to make better use of our network of collaborating centers, which includes over 800 research institutes in 80 countries. That's why in April this year, we convened the first global forum of WHO collaborating centers in Lyon, which involved 577 collaborating centers from all 6 regions and almost 1,200 participants. I would like to use this opportunity to thank His Excellency President Emmanuel Macron for his support and presence during that conference. To strengthen our core mandate on norms and standards, we also launched a 3-year project to modernize the way WHO prioritizes, develops, and disseminates our highest priority guidelines. Also last year, we launched a new global action plan and a new global network to strengthen clinical trials involving 34 major research institutions. And this year, we're celebrating 25 years of Research for Life and HINARI, which makes scientific publications available for free or at very low cost in low and middle-income countries, helping to address inequities in access to scientific publications and strengthening trust in science. Finally, we continue to take steps to make WHO more accountable, transparent, efficient, and effective under the 5th P of GPW14, Perform for Health. We continue to prioritize WHO support to countries by preserving our country presence. Through the work of the Action for Results Group, we have implemented the core country office model, which is helping to achieve an effective, efficient, empowered, and result-oriented, result-focused country presence. We also expanded our evaluation function and improved completion rates. In the past 12 months, WHO's Office of Internal Oversight Services completed 19 audits with no unsatisfactory conclusions. Our investigations function handled 1,174 cases and closed 636 cases. The year-end caseload fell to 656, which is the lowest in 3 years. For the first time, Member States agreed to include a gender equality indicator in the results framework in GPW14, and the Global Risk Management Committee continues to assess the risks to WHO's success. The number one risk on its list is tightly earmarked, unpredictable, and non-diversified financing, alongside significant reductions in financing. That's why it's essential that Member States approve the remaining increases in assessed contributions to make WHO more stable, resilient, and independent, as I said in my welcome speech yesterday. Excellencies, honorable ministers, Mr. President, there is no denying that for WHO and the countries we serve, the past year was a difficult one. I would like to place on record my deep respect and gratitude to the WHO colleagues who are no longer with us and to those who still are and who continue to serve the organization and Member States with dedication. I likewise thank Member States for your support and trust throughout. Thank you so much. This week, you will consider many significant challenges in global health, antimicrobial resistance, malaria, emergencies, and more, as well as the proposal for a Member State-led joint process on reform of the global health architecture. For 78 years, this Assembly has been where the world meets to confront shared threats with a shared response. Multilateralism is not easy, but it's worth it. National sovereignty and international cooperation are not mutually exclusive. They are mutually reinforcing. When I was in Tenerife last week, supporting the disembarkment of passengers from the MV Hondius under the leadership of Spain, the Prime Minister and Minister Monica, who is here with us, it occurred to me that the cruise ship is a lot like our world. In that small ship, 23 countries, citizens from 23 countries. The passengers on the ship were from many different countries, but they faced a shared threat. Our mission was just to keep everyone safe and to get everyone home, because that's what we do as WHO. It's the same with our world. We're all in the same boat. We're stronger and safer together as one world. That's why WHO was created in 1948. That's why it remains relevant today. And that's why its vision must remain our driving force this week. The highest attainable standard of health, not as a luxury for some, but a right for all. As Prime Minister Sanchez said yesterday, we need a contagion of solidarity, because solidarity is our best immunity. I wish you all a very productive 79th World Health Assembly, and I thank you. Thank you so much.